Hello, my name is Isabella Schultz, and I am a rising senior at the University of Florida, and I am a McNair Scholar, and my mentor is Dr. Adrian Strong in the Anthropology Department. My presentation is Pathways to Maternal Death in the Hospital, the Importance of Missing Information and Case Comparison Data from Tanzania. So a little background information. In 2017, about 810 women died every day from complications relating to pregnancy and childbirth, and about 94% of all maternal deaths occur in low-income countries, which would include Tanzania, and those statistics are by the World Health Organization. Tanzania's maternal mortality rate is 524 deaths per every 100,000 live births, and that was in 2017, done by the World Bank. And so those are really important numbers in a way that Tanzania has tried to lower the maternal mortality rate is by implementing maternal death reviews, and that was done in 2006. And so the site of my study is the Sumbawanga Regional Referral Hospital in Rukwa region of Tanzania. The problem that my research is focusing on is that maternal mortality rates in Tanzania are not decreasing, even though they have participated in the past in the Millennium Development Goals, which stated that from 1990 to 2015, one of the goals would be to reduce maternal death by 3/4. And unfortunately, Tanzania was unable to do that. And so we will be looking at why that happened, especially when during that time period, Tanzania implemented the maternal death reviews, which were supposed to kind of help the doctors and medical staff pinpoint what exactly went wrong that led the mother to die. And so during a literature review, I looked at a lot of research that looked at maternal death reviews, and we found that there were constant fears of blame going on in these meetings and lack of accountability. And in addition to that, in this specific regional hospital, I've seen that there's a lot of missing information in the medical files, and so we're kind of going to be looking at how that affects maternal death audit meetings, especially if these meetings are often delayed weeks or months at a time. So how can these doctors be effectively using these meetings to understand what went wrong when there's a lot of missing information in the files that they're supposed to be relying on? So the purpose of the study is basically to use the medical histories and field notes from maternal death audit meetings from this regional hospital to run quantitative and qualitative analysis to look at how missing information, lack of accountability, and barriers to care are diminishing the potential that maternal death audit meetings could have on lowering this maternal mortality rate. So my specific research questions that I'm looking at are: what are the general pathways used to treat different obstetric emergencies and deviations from them that can be seen within medical files? Is it possible through examining medical records to reveal systematic weaknesses that could sometimes result in a woman's death? How do medical files and the missing information in them influence maternal death audit meetings? And how do clinicians work to interpret missing data in these files? So I know that there's a lot of research questions, but they basically cover all of the main themes that I want to look into using notes from the maternal death audit meetings and the medical files that I have access to. So my methods are pretty intense, but they basically follow the general 5-step maternal mortality surveillance approach, which we are identifying cases, we are collecting data from them, we are running data analysis, and then we looked at potential recommendations that we could offer and evaluate how those could be implemented. So the 3 categories of non-clinical information from the medical records that I will be extracting are institutional and organizational problems, structural problems related to Tanzania's health sector, and social interactions in the hospital. And examples of each of those things are looking at if the hospital has ability to be administering all the drugs that are prescribed. Do they have enough blood for blood transfusions? Do they have the ability to be running tests for malaria if that is necessary? We're also going to be looking at how many times do the patients interact with doctors and nurses, and how long does it take them to receive care once they're admitted to this hospital? And so these are all things that we'll be looking at within the medical files. The second part of my methods includes looking at the presence and absence of the following variables. So when you look at the time of admittance, is the date, the time, is that all recorded? And same for time of death. If the blood pressure is taken on arrival, because blood pressure is a great indicator if something is wrong, especially when you're looking at preeclampsia. Is their age recorded? Is gravidity and parity recorded? Because we need to know the number of previous pregnancies that these women have had and how many births that they've had. Is the diagnosis recorded? And is their method of delivery recorded? That is very important and kind of gives us a great idea of how the hospital is like functioning and if they are like properly recording everything that is needed. The other thing that we'll be looking at is coding all of the maternal death audit meetings, of the notes that I have access to, and looking at accountability, blame, anytime they talked about using the medical files, and the most common interventions they discussed implementing based on what they've seen as to why these women died. So here we are looking at some of the data that I have already collected because I'm currently in the process of finishing collecting all my data. So here we have the file numbers. You can see I've looked at the date and time of admission and even the day of the week. So when that is available, I will record it, and then you can see there are times where I have written no time because I could not find the actual time that that patient was admitted. And these are for the live patient, the patients that lived. We also have a date of discharge, when they were released from the hospital, although sometimes that was not specifically said when they were able to leave. Sometimes it just has a date, and then the times were estimated looking on when they last received medicine and things like that. So I also tried to see how long they stayed at the hospital, what region they're from, if they have education, and their age. And on the bottom, it shows gravida and parity, and then blood pressure. We just looked at whether that was present or absent, and output, so that's if they're recording urine, if they're giving them any medicines, you have to be recording all the output and testing that. And so that was to see if this was actually taken. I have method of delivery. And then we looked at medications that were ordered and the ones that were actually given, the number of doctors. What you can't see from these screenshots is that we also looked obviously at diagnosis. I had a section for adding in extra notes. And so this was basically everything that I recorded for all of the patients that had survived. This is an example of another chart that I have that is for the woman that unfortunately passed away. And so it just has some basic information that we have looked at, like cause of death, age, gravidity, parity, what district they're from within the region, and looking at their complications that were listed, as well as the cause of death, because that can be very important in the maternal death audit meetings, in case they try to rule this a non-maternal death based on other complications that existed. And here I have broken down so you can see how many women have come from each district. The next steps for my research is going to be to code all of the interviews for the themes I mentioned previously. I'm going to run statistical analysis on all of the data that I've collected from both the cases of the women that survived and the ones that unfortunately passed away for comparison. And then I'm also going to analyze all the data that I collected, so that includes looking at the interviews and looking at the medical files and kind of seeing what information I've gathered from all of them. And then I will potentially be offering recommendations on what the hospital should try and look at fixing so they can lower the maternal mortality rate. These are all my references that I've used in this presentation. I would like to thank Dr. Strong for including me in this research, and I would like to thank everyone at the McNair program at UF for encouraging us all to be part of this conference. And I would like to thank the College of Liberal Arts and Science at UF for giving me a grant to conduct this research. Thank you.